No, you're perfect. Perfect. Good morning, everyone. Thank you so much for joining. If you're joining live and if you're watching at a better time for you, we're going to walk through the office hours. And this week, our office hours, we have a phenomenal guest to share a conversation about heart health, about a systems approach, and just share some incredible resources. Make sure you check out the link around this post because we have information on both our Heart Healthy program, our Be Heart Healthy program for practitioners. If you sign up, you can invite your clients to participate. And we also have information. Cindy is also doing a webinar, more in-depth webinar for practitioners through DIFM on February 13th. So a lot of heart health stuff to get to. I wanted to start here. First of all, for those of you that I haven't met, or this is your first time in the group and first time checking out office hours, welcome. My name is Ashley Koff. I'm a registered dietitian. I've been doing that for about 20 years. Before that, I was selling sugared cereal to America and teaching them how good it was for them and putting the American Heart Association on any cereal we paid for, really, as long as it didn't have too much fat. So mea culpa, mea culpa, mea culpa. So change things up a bit. And now I'm also CEO of the Better Nutrition Program. We have a company that develops total nutrition assessment tools for practitioners, developed by leading practitioners with the idea that, one, you should not be taking your time to develop these things. It takes me a lot of time. But number two, when you have better assessment tools, when you have better tools, you can get a more complete picture of your client, really understand their systems, which is what we're going to talk about today. And the win of our tools is also that they are great marketing tools. The best referral generator is showing a practitioner how you are going to do your stuff and make their outcomes, their business, their results better as well. So I like to say in 2020, the better business card is a better nutrition assessment. So we will start there. If you have any questions about anything, let's save it until we're at the end. I do have a couple of questions that came in from practitioners specifically about both using the tools and a little bit of information on heart health. So I promise that I will get to those at the end, because right now I want to introduce Cindy Carroll, who I have become just a massive fan of. So thank you so much for, we connected, and I think it was this love affair on the phone of just your approach and what you've accomplished and what you're offering by way of your different training programs, both as a nurse, as a functional practitioner, and then also obviously as a dietitian. So Cindy, first of all, welcome. And if you can share for us just for a minute or two, a little bit about kind of what your approach is, what you're doing right now, and then we'll dive into the heart health component of it.
Okay, thank you, Ashley. Yeah, so much. I'm delighted to be here. And I think that our approaches and perspectives are so complementary. So I'm really, really thrilled that you invited me. So I launched this year, actually it's been about a year now, last year, the Institute for Functional Nutrition. And I focus, I've had a private practice for a long time and seeing patients for most of my career. But I focus right now on educating other nutrition professionals to think of, and it's really kind of a mindset, if you will, too, to be thinking of nutrition in terms of systems of the body. And I focus on 5 systems, although there are a lot more systems. And I think it's important first just to kind of recognize what systems biology is, because it's a term that's thrown around a lot, right, amongst functional practitioners. And you could be someone really that doesn't even practice functional medicine and be thinking intuitively of the systems, which is great. And I would say that was probably me back earlier in my career. It was just something that I always did. But it's systems biology it's very cool, really. It's a discipline in all of biology. So it doesn't just affect humans. It's really how any organism, the systems communicate and help that organism stay in homeostasis or a balance. And so, of course, humans, we're complicated, right? We've got lots of systems of the body, and we're going to talk today about the cardiovascular system, but how those systems communicate to stay healthy. And it's no easy task to learn this stuff. It's a lot of information. And so for me, I go back to the basics and really educate about anatomy and physiology, which is basically structure and function of the body. And you might think, I took A&P a long time ago. I've done that. But it's really an ongoing process. I mean, I think I learn things every day new about the body. So that's sort of my approach. And I do teach a course that is coming up. I'm going to be taping in. I'm aiming for the end of spring. I did a live course last year, and where I met you actually at FNCP, Ashley, which was awesome. And I had great response from dietitians that came to my table. So it sort of convinced me to make it a taped webinar so it can get to more people. So that's what I'm doing with the coursework. And soon to come, in the next couple of weeks, I will have like an assessment tool of sorts, a systems biology assessment tool that's coming out of in my website that looks at all 5 of these systems and what's important and how to use it in your toolkit, because it really is a mindset, I think, to be thinking of all of these systems all of the time while you're evaluating your patients.
Awesome. Well, one of the things that I think when it comes to heart health, so first of all, we all know this, but let's just go ahead and dive into it. Leading killer, 1 in 3 adults, 49%. And we're supposed to be thinking like cholesterol. Cholesterol, is the answer. So if we just get somebody's cholesterol to be good, of course, like nothing else could happen to their heart. # totally false. And so I think, it's something right now, the stats are crazy. Over 50% of heart attacks happen in individuals with healthy cholesterol, and that may be healthy cholesterol is managed by a statin, or it could be without. So obviously there's a larger component to this. And I've shared with some of you before about my patient Joe. I have a heart webinar, a heart assessment webinar on our YouTube page. And, Joe came to me, like so many of our clients, and said, I just want to be statin free, Ashley. I've got this family history of heart disease. I was doing well, but my labs are a little bit up. My blood pressure's up. Well, it turns out he's, was very stressed. And we started to figure out like what else was going on. But his doctor said, nutrition, like I'll let you try it, and I'll even let you try it for 3 months, but like nutrition just doesn't work. I'm going to put you on a statin. And I said to him, you know what, Joe, you're right. Nutrition doesn't work. But total nutrition that helps us understand how your systems, as you were just talking about, communicate together, it totally does. It's something I'll bank my 20 years of experience on. And one of the things that I found out when we were talking about assessment, when I did Joe's assessment, was I learned first and foremost that his digestion was totally off. So not only was he not pooping, he had reflux, he had, was taking Tums to deal with it. He was a total stress mess package, right, going on. Why do I bring that up? We're about to dive into the cardiovascular system, but it would be embarrassing to any of us to think that the cardiovascular system exists in absence of interaction with other systems. So as we go into this discussion today, one of the things that I want you to think about and be thinking about, whether you're participating in our Be Heart Healthy program or whether you're talking to cardiologists about wanting to work with their patients, is that by doing a digestive assessment for those patients, that is that first step. And so, when we start to talk about the cardiovascular system, I want us to just remember it is also dependent on a healthy digestive system. And I could have Cindy here for an hour or for 5 hours talking about that part. And maybe we'll pop back in and do that piece, but I just didn't want us to forget about that part. So that's me stepping off of my soapbox and just starting off with the digestive piece. So, Cindy, what I wanted to dive into as we were talking about with the cardiovascular system assessment, help us understand how we as practitioners, dietitians, health coaches, medical professionals, nurses, how we need to be thinking about the cardiovascular system.
Well, I'm right there on that soapbox with the GI tract too. So we'll dive into that in the DIFM webinar actually next week.
Great.
So the cardiovascular system, I'd like to just say first off to get a little bit of just basics about it. It's kind of a simplistic system when you think about it compared to like the GI tract. It's got, basically three components to it. We have the heart, we've got vessels of varying sizes, capillaries on up to the aorta, and then blood, which of course carries oxygen and nutrients. But it's the vasculature which carries oxygen from basically vessels from head to toe. And that's where everything is accessible to our vessels. So is potentially at risk and also gains the benefit of that. Mm. And then just to go back to your comment, and then that's all I'll go on about the GI tract, because I know we can go on a lot about that. But the vasculature is what I call one of the 4 key ingredients of the GI tract, and why it's so important to the health of the rest of the body, because we talk a lot about the gut microbiome, a lot about the immune system in the GI tract, but We don't talk as much about the extensive vasculature in the GI tract, which makes the gut health so important to the rest of the body. But getting back to just the cardiovascular system itself, we have vessels from head to toe. So to protect those vessels, that's what it's all about, is protecting that endothelial lining in the inside of those vessels, which is almost an organ in itself. So it gets, the basics of it is vascular injury versus vascular repair. And what can we do to protect that balance? Because we are exposed to an infinite number of hits all the time. I follow a lot of Dr. Mark Houston, the cardiologist's work. I think he's awesome. Mm-hmm. And he says he estimates there's over 400 risk factors for heart disease. Mm-hmm. And, it's not just the standard things that we think about for heart disease. It's pretty much our body, our vessels are exposed to so many things. And so nutrition, which I didn't say earlier, which is the obvious thing, is so related to every system in the body. So it places us in the nutrition profession in a very influential position in medicine because it does affect everything, really. So and we'll get into maybe the...
Yeah, and let me pause there because I want to ask us to dive a little bit deeper as we go into this. I think that just paying attention to that endothelia, or the idea that we have these vessels, again, and I think I'm not going to be able to stop with this shared discussion of digestion and the other. I think when we talk to people about their digestive tract and we teach them about the mucosal layer and the lining of the digestive tract, and now you're talking about the endothelial layer and the lining of the vessels, why that's so important for us to understand, because, so much of what's happening in these tubes, if you will, throughout our body, I think a lot of attention has been given over the years to what's transported in those tubes. And what we're realizing is massive, massive impact happens with the health of those tubes. Like what can happen, whether it's in the case of the digestive system, keeping things out or supporting optimal absorption. And certainly in the case of from a heart standard, the cardiovascular system, we don't, plaque, like in terms of plaque buildup. So if we just honed in, and I know I'm asking you to go super deep and then pull back out, and what I want to just remind everyone here is that I asked Cindy to pop in here for 20 to 30 minutes and share with us what her entire course would take you through, and also what she's discussing in the DIFM webinar. So do not fret if you are wanting for more, which I will imagine certainly that you will be. We're going to give you resources and continue to have you connect with her in addition. So going to that endothelial layer, tell us a little bit about nutrition and what's affecting the health of that endothelial layer, because I think that's so important.
So the endothelial lining, it's an awesome question because it really places pretty much everyone at risk. So, you might think, who should we be targeting here to protect us against heart disease? And the old school is to be thinking about perhaps obesity, sedentary, hypertension, but pretty much everyone's endothelial lining is susceptible. You're never too young to start protecting your endothelial lining because it's a process. Heart disease is a process that occurs over time. And goes back to that injury versus repair. And, some of it is related to, and I know I get sort of hung up on these phrases sometimes, but anatomy and physiology is basically structure and function. And anatomy or structure doesn't change too much, right, in the human being, but we've learned so much more about it because of technology over the years. But the function or physiology is what we've really come to understand better. And the function of the endothelial lining, and it has receptors in it that respond to many things. Basically, it communicates. It's thought to be almost an organ in itself. It communicates with the outside of the vessel. And it responds to nutrition. So nutrition is a huge component of vessel health and endothelial health. Many nutrients affect those receptors and potentially produce these other mediators that can be protective or not so protective to the vessels. And so that's why the Mediterranean diet is so huge. I'm a huge fan of that diet because it has a variety of foods in it that have a number of different effects. And, it probably is the most researched diet when it comes to heart disease. And we are learning that those protective effects didn't know it at the time back in the beginning of the research of why it was such a quote unquote anti-inflammatory diet and protective to the endothelial lining. But now we're understanding it's because it has so many components that activate the gut microbiome, right? And those organisms, we get more beneficial organisms that produce these bioactive compounds that connect with. So remember, the GI tract has all this vasculature. So if we have the vessels that are exposed to a healthy GI tract, then we have more positive effect on the endothelial lining. And if the diet is healthy and we get healthy foods in there, which we could go on, we can start listing some of the healthy foods that are good for the.
Yeah, well, I think, and in lieu of listing all of the foods, you got to the point that I so desperately wanted us to get to and get to quickly, which is there is no one nutrient. There's no one phytonutrient that supports heart health. So, this whole debate about cholesterol, this whole debate about sodium, this whole debate about calcium, which we can even talk about, as it relates to the endothelial, it's ridiculous to look at a single nutrient. So certainly in our heart health assessment, one of the reasons we look at all the different ways you're taking a nutrient and so many different groups, and to your point, assess that whole piece, is that there's two things. One, it's a ton of different nutrients. And number two, the solution, the better total nutrition solution, is going to come from a variety. I think that the notion that you were just talking about with variety at the core of the Mediterranean diet is what was so important. I wonder why my slides just popped up. That was really weird. Sorry. Why the Mediterranean diet, why that's so important to helping your patients. So, not pinpointing walnuts as good for health, but talking about how nuts and seeds provide all of these different nutrients. And so what that does is it really is a gateway for you, the practitioner, to have a conversation with your patients about heart health as a lead in to a conversation about their overall nutrition. So I absolutely love that you brought that one up. I think the other thing about the Mediterranean diet, and this is just to foreshadow where we're going in this conversation and make sure everyone feels that their question is going to get answers. We got about 12 questions that came in around supplements. So the Mediterranean diet is about total nutrition, but the foundation of it is food. So when we start to replace supplements, we need to make sure that the supplements would be doing what the food is doing and not just looking at those, individual nutrients on that piece. So coming back, yeah, go ahead. There you go.
I was going to say just one comment on that, and this just, gets into the whole, it's one aspect. I think so much is orchestrated by these gut microbiome, which supplements, although they do, I think they can provide some benefit, and they probably affect the gut microbiome too in certain ways. But food, so much of that's why the fasting mimicking diet, which is a very interesting thing that I know we don't have time to talk about, but part of the benefit of that is perhaps through the food that's actually provided while you're, and then your body mimics the fasting state versus fasting just by itself with just water. So we can't underestimate the value of food and what the effects it have, both positive and negative, on that gut microbiome, and then the effects potentially on the cardiovascular system because of the huge network of vessels that comes out of the gut. And then in the DIFM talk next week, we're going to talk about some of the negative things that come out of the gut and how that really increases cardiovascular risk. And that is so important for us to recognize as practitioners because we're right there on the front lines to be able to identify that.
Yeah. And I think we're also on the front lines of being able to myth bust. One of the things that I think is why I so highly recommend that people connect with you and follow, whether it's taking the course that will later be available or participating in the DIFM webinar, or I learned so much when you publish your newsletter and I find it entertaining. So thank you. But we need to myth bust. So we need to myth bust and make sure that we're not talking about just one nutrient, but also, you were talking about in the beginning, and I love it that you defined systems biology. The lexicon of better nutrition has a lot of really confusing points. So for example, with heart health, we'll often hear about like sodium nitrate. And so we get these like headlines like nitrates, so bad for your, for heart health. And then you turn and you look at the foods and you say, wait a minute, plant nitrates are amazing for heart health. So I think, one of the other things that both our tool allows you to do, the assessment tool, and then also taking the systems approach, is to actually pop in and say, hey, let me myth bust. It is not as simple as your cholesterol or even just understanding what nutrients to put in, as Cindy was just talking about, but also what things we need to reduce or improve or, or even eliminate in terms of that part. So if we move from the deep endothelial conversation into that part and think a little bit more about the heart, the cardiovascular system, take me through where you would go from that conversation as you're doing a system assessment from the endothelial further into cardiovascular.
You mean in terms of like how that affects health in general?
Well, and heart function, right? So we, at the end of so we haven't gotten yet to, I guess, the heart muscle. So I wanted to get in there. It's like, so yes, there's massive, massive importance that we have to put on the vasculature, but we also need to understand and make sure that we're providing the nutrition and having the conversation about the health of that heart muscle.
Well, I'm glad you actually, that's really, I have kind of a unique perspective on just the heart muscle itself, because I think it's such a unique organ in that when you think about it, it's pumping 24 hours a day, right? It's pumping when you're sleeping, hopefully. It's contracting and pumping. And I like to look at it sometimes just to give the quick example, because it really puts an impression on you on the heart as a muscle. When you think about the health of any given individual across the healthcare spectrum, if you take, like, for instance, elite athletes, okay, and you think of all of the stresses that they might be under, the heart has to pump under. So it could be an endurance athlete, it could be a sprinter, it could be a power lifter, it could be a military soldier who has, a 50-pound backpack on their back and is exposed to lots of environmental stresses. All of those things, put stress on the heart. And then yet you go to the other end of the healthcare spectrum and you look at someone who is perhaps on hospice care. And so I've worked as a hospice nurse before, and perhaps their organs are failing, so they might not have their kidney function, their liver function, and the doctor might say, they don't expect them to live much longer. And if they have a strong heart, those days could go into weeks. And we, all of us perhaps know someone that has been like that. So if that heart muscle is healthy and is able to pump, and it's not true for everyone, and is pumping blood to the rest of the body, then, it pumps the average person, it's 1,500 to 2,000 gallons of blood a day on average for the average adult. So it's, of course, really important, because if we're not pumping blood and that endothelial lining gets compromised because for whatever reason it gets damaged, and a clot forms, or there are various things of how the cells inside the lining become damaged, so that it increases the risks for a heart attack, because we don't want to block the passage of blood to any part of the body. And that's why, like blood sugar is so important to the health of the inside of the vessel. So many years ago we would think of diabetes and you don't really think about heart disease, but if you have a vessel, then that potential organ is susceptible if blood sugar is high. Mm-hmm. So that's why you hear people with diabetes have eye problems or perhaps have lost a toe. It's that vasculature that has become compromised because of it. So, you ask about one of the myths. One of my maybe it's a pet peeve of mine for those people who know me really well, is not checking insulin. Mm-hmm. I'm such a big proponent of checking insulin, fasting insulin, mm-hmm. and if you can, to get it with a fasting blood glucose, because it's not that expensive and it really can give a good indication of heart health, of the vessel health.
Yeah. So I want to dive in on this, because I think when one of the questions that comes up with this system is like, how do we assess it, right? And I was actually doing a training couple of nights ago for integrative doctors and fellows through an university's integrative medicine program. And one of the doctors said to me, wait, could you just help me understand which labs are the most important? And I said, well, with all due respect, sir, we don't look at labs as what's most important. We're looking for a story in the labs. They're going to help us provide that information. And then we're going to connect that with their total nutrition assessment and start to understand the root cause of what's going on with those labs. So he said to me, right, I get that. But, do you look at triglycerides? Do you look at fasting? I said, okay, so when you're talking about this, and I do think with the cardiovascular system, we really need to be looking, SED rate, CRP, hemoglobin A1C, that marker of glycation is going to be really important. When we're looking at the cholesterol labs, that's totally fine to look at, but we also want to look deeper at lipoproteins, maybe lipoprotein A, if there's a family history. And I think one of those pieces in there, and then I said to him, I was like, and you could do an assessment of, and talking about the heart muscle, of magnesium, but you'd be kind of missing something. Yes, we can do a calcium scan, but what we really want to understand is that relationship between calcium and magnesium, because to your point of pumping, they pump better when they're in a better balance. And so one of the things that as a healthcare practitioner, I encourage you to do, whether doctor, dietitian, whatever your approach is here, is to really have that conversation, do the assessment of total nutrition of calcium and magnesium, because a lab isn't going to tell us if the heart health, the heart muscle is getting that better balance of what it needs to, pump in that space. So I am so there with you with assessment of looking at the blood sugar component and that whole piece. I want to go back to this notion of injury and the fact that there are all of these risk factors. I basically think like living in 2020 is just a risk factor. And so we have to just figure out what are we doing and, on that piece. But one of the areas that often that's starting to have a greater conversation, and I'm curious how it's how or in what way, or if you are having a conversation in the system space around genetics, because there's a lot of questions that I get about, I just mentioned lipoprotein A, there's obviously a major genetic component there, methylation, so MTHFR, B vitamins, we know its role in homocysteine. So when you look at systems, how does the idea of genetics interact with systems assessment of what we see and understand right now?
So that's like a whole field, truly, is the genomics of cardiovascular health. And it brings into understanding why some people, we all probably know, why maybe a lean person who's never smoked and exercises have a heart attack. And they perhaps have certain SNPs that make them more susceptible. And the SNPs could be, that's such a big area of understanding which ones are the most relevant ones, and not to get too hung up on the ones that we don't have enough evidence yet to show, because that can freak people out too. Mm-hmm. We have there's a lot of TMI, I think, with some of the genomics. I'm a huge fan of genomics though, because I think it's interesting. I use it in my practice, and I find that it tells, I don't use it to dictate my treatment or my care, but it explains a lot of things when you go back and look. And so even, for example, people that have the ApoE4 gene are a little more susceptible perhaps to saturated fat. Mm-hmm. So you might want to be a little more careful with saturated fat with them. Saturated fat, I don't think, is the evil of all evils, though. I think it's the source of the animal is more important, but there are some people perhaps that need to be a little bit more careful about it. So, and then there's gene SNPs that are related to detoxification that indirectly affect how, like you mentioned, homocysteine, and homocysteine is very much related to inflammation. So there's a whole panel of inflammatory markers that I encourage I have my patients I make my little dream lab request sheet of things that potentially could be checked because they're inflammatory markers that give an indication of, the vessel. And you mentioned C-reactive protein. That's thought to be, even though it's kind of a broader inflammatory marker, mm-hmm. on the, above 3 is thought to be, show more probably acute inflammation. But when you bring it down and look at people that have consistently between 1 and 3, as a result of as C-reactive protein, that's something to look closer at in terms of cardiovascular health, because that's something that's there all the time. Mm-hmm. You think about it's inflammation that's present all the time in the person, and that's why it starts early, cardiovascular mm-hmm. health, because we don't know. It's kind of that's why where the silent killer unfortunately comes in, right? It's something that's happening in the background, and we're not as much aware of it. Like GI symptoms, we're more aware of it because the symptoms really present themselves. But in terms of heart health, unfortunately, until someone has an event, we sometimes don't know what's going on inside of them. Mm-hmm. So
I love that. So let's do a little bit more myth busting. I mentioned nitrates because that's one that I enjoy, or cholesterol. Talk a little bit about, from a myth standpoint, what you think, if you can just think of one or two that like pop up to mind that you think that as practitioners, by using this, combination of total nutrition assessment and a systems approach assessment, that we can debunk beautifully, masterfully, if you will.
Well, one, I don't know if it's a myth, but it kind of is a myth. At least there's an idea out there about coconut oil, being really healthy for your heart. And I would argue, I think there's the quality of the oil, and it's, of the saturated fat, it's the longer chain fats that are so thought to be probably not as healthy in coconut oil, even though it has some medium chain triglycerides in it, which may have some benefit. It's more than 90% saturated fat. So I'm a little cautious of my patients that come in and everything is coconut oil. I try to encourage a broader range of fats, including, of course, omega-3s and monounsaturated fat, which is really evident in the Mediterranean diet. The nuts and seeds and olive oil that, you can add to things. So perhaps the coconut oil myth. I mean, I don't think, I think we have to be careful just with its overuse.
And I will just echo, I spent some time very quickly in Bali years ago. I was doing a story, tough luck for me, on coconut palm sugar and the release of that. And I got to go around and see different dietary choices. And it was really interesting because we had this conversation amongst healthcare practitioners that were there, and they were saying, we don't use coconut, like it's a myth. We have coconuts like literally raining down upon us, but we don't use coconut oil for everything. We use coconuts for a lot of stuff, right? And so it was like, how are you? Right. So we have to also remember at a certain point that coconut oil is an extraction from the actual coconut, which provides, like for example, in coconut water, you're getting a ton of potassium, you're getting, all these other minerals, you've got, so like fiber actually in regular coconut, right? And so I think like that part of, when we just look at oils, we can often forget that there like is a piece there, that we're missing. And they would also say too that it's something that they use with spices and they use with vegetables, so it's like, okay, or fruits or, that piece. So I found that really interesting. On the flip side, I also found a very high intake of meats, and especially over open fires, grilled meats, very, very overdone meats and cooked. And so I was sitting there saying, like, if we start to look at that research, I'm going to be more worried about the carcinogen impact of, cooking that meat at that higher temperature. But I'm so on the same page with you. And I think, again, not to, we're here to beat this drum, but one of the reasons I'm so passionate about total nutrition assessment for heart health is what is heart healthy is a variety of foods, and that includes where your fats are coming from. And instead of even just isolating fat as an ingredient. So yes, 100%.
Just to add to that and kind of to go back to what we were talking about earlier too about saturated fat, it's a little bit of, I think, a myth that saturated fat is so bad. It depends on the person. Some people are more susceptible to it. And I think perhaps the worst saturated fat, the environment or the context, I feel like could potentially be the ketogenic diet for people long term. That's going to be high in saturated fat, which I think in the short term, in my experience, can be beneficial for some people, but potentially can actually cause insulin resistance in some people. And then it does change the gut microbiome. So saturated fat in the context of like the Mediterranean diet, where you're getting other plant phenols and you're getting a better, place for those organisms to thrive and produce more beneficial metabolites, is probably better than it kind of like taking one single thing out of the context and just focusing on one area. That's not how the body works, right? With systems biology, there's a lot of moving parts going on, and so that's what annoys me a little bit with some certain research that'll take a piece out of the diet and say this is bad. Right. We have to be careful with that.
I totally agree. And I actually was just having a conversation on the ketogenic diet. And look, you could do a ketogenic Mediterranean diet, right? You can look at So I think one of the things, again, that's this massive area for us as healthcare practitioners is to say, like, it's not about keto or vegan or paleo. It's about Susie or Jim or Jane. Like, so Susie's keto could, if she's going to do a great job of bringing in spices, which don't provide carbohydrate, and getting in a variety of fats that you were just talking about, that are great from the Mediterranean diet, awesome. You probably are going to have to dial in a pretty serious supplement game there, though, because I don't know what, like, even as much as I love cacao and hemp seeds, I don't know how you get enough magnesium and for me, I think, like, not just the digestive impact of magnesium, but, I'm just a nicer person when my body can turn off the stress response.
The magnesium factor.
Yes.
I always say, like, the $1 million question with the range of being in ketosis or the range of carbohydrates is about what's the amount for each person that's going to promote a gut flora that's healthy and be protective to your blood sugar, which of course is related, and it's just different. It's just it's a range, and I don't think it could be, it's a different amount of carbs for each person, but the component of those carbohydrates along with the fats is so important.
So I'm just conscious of time. We have a set of questions, so I'd like to invite you to stay on for these questions, even though these are some of the questions I received external to hear. Thank you. Someone acknowledged that they were really glad that you mentioned fasting mimicking diet. So we will come to that. Somebody else wanted to see the assessment. So I do have, okay, great. So we can see this is just a component of the first page of the Better Heart Health cholesterol assessment. We use this for all of our patients coming into the Be Heart Healthy program, and then we reassess it. But as I was saying in the beginning, this is also your Better business card, because if you fill this out, even if you fill it out as a sample, as an example, and share this information, and this is just page 1, page 2 and page 3 go on about supplements and also go on about lifestyle factors, preferences, things like that. So you will be able to demonstrate to that cardiologist or that the other practitioners that you're wanting to collaborate with on their patients that you're going to gather a bunch of really critical information and be able to share that. So if you would like more information, you can always email us at team. I don't want to take up too much on that part. So Cindy, one of the other things that came in terms of a question was somebody was asking a question about and again, some of these are just kind of very specific and all over the place. So I'll try to provide context or group them. But somebody asked if we recommend calcium as a supplement because of the heart health issue. So I'll let you take that one first, and I can share some thoughts afterwards if relevant.
Well, I think that's a really good question, right? Because we hear patients come in and they're on these high calcium supplements. And again, I think it's, unfortunately, we focus on one system of the body, one nutrient, and think that's how it's going to happen and work in the body. And calcium actually, as it turns out, I think we're gaining more evidence to show that, yes, it can deposit in vessels and that it does deposit in bone, but there's different mechanisms to get it to its destination. And some people are more susceptible than others. So, I'm not a big fan of calcium supplements. I actually don't like people to have more than 500 milligrams a day of calcium. But back to, we mentioned earlier calcium and magnesium. Interestingly, vitamin K2 is not a nutrient that gets a lot of attention, but it's important in helping calcium not to be deposited in your vessels and to be deposited in your bones. Mm-hmm. So that's a growing area of research. And to make kind of our points even more is, you could take a vitamin K2 supplement, which I'm okay with, but where do you get that in your diet? Well, dairy products, a little bit fattier foods, fermented foods have vitamin K2. So it's not a restricted diet that's going to get more vitamin K2. So there's so many nutrients that are important, but that's related to calcium. And I'm not a big fan of calcium supplements. Yeah. I think a small amount along with magnesium, along with vitamin D, and a few other nutrients are really important for bone health and don't put the body at risk for cardiovascular disease.
Yeah, I think if we were Siskel and Ebert, for those of you, I'm dating myself, but for those of you who remember, you would be getting 2 thumbs up. I am not a fan ever of recommending a supplement. I am a fan of doing a total nutrition assessment, identifying if somebody's getting in calcium, are they getting in enough, are they getting in too little, and then figuring out the best approach to helping them get calcium in, and then being super, super careful if you are going to supplement with calcium about the form, about the quantity, and about these complementary nutrients. So I think really great point. I share with people all the time, when somebody switches from milk to almond milk, they may increase their calcium intake by 50%. We're seeing a lot of fortification with calcium. We see a lot of problems. And let's go back to heart disease being a number one killer of women. Women have much more, have had high doses of calcium supplementation recommended much, much more significantly than men. And so I think this is a really important one. And again, a calling card for you as practitioners to mention to doctors that you will, or to practitioners and to patients, that you're going to do a total nutrition assessment to see if there are conflicts with their supplements and with their food intake and how you can improve upon that. So I absolutely love that. Somebody else was asking and I'm glad that you brought up K2, and they were saying, what other nutrients besides, hold on, I thought I had it in my brain and then I didn't look at it. What other nutrients? Oh, so we just basically answered it, so never mind with the vitamin K. Okay, so let's go on to another one, which is there's a conversation about fiber and cholesterol. And what do you recommend related to fiber? I have a feeling we're going to say the exact same thing that we were saying through the start of this, but go ahead, Cindy. I'll leave that to you in terms of, like, let's say, does fiber work to improve cholesterol is the question. Yeah.
Well, sort of, just in the old school, and I think there's still evidence to show for it. Yes, soluble fiber can help reduce cholesterol if we're really looking very narrowly in that view. But I kind of think of fiber now. There's many different types of fiber. There's prebiotics, there's resistant starches. So all of those types of fiber in food have various effects, again, on these gut metabolites, which affect heart health. Mm-hmm. So when I think of fiber for a person, I'm really thinking of how their GI tract tolerates it, first of all. So that goes back to your GI assessment, right? Because sometimes just adding fiber for people, I know people, you add oatmeal and they're not going to go to the bathroom. It actually can be constipating for some people. So it really involves assessing their GI health and to determine what fiber is best for them. But there's a lot of great research that does show soluble fibers can help, reduce cholesterol. And I think that's a proven thing to do for certain people. But again, it's not the only piece. And the great thing about nutrition is that when you start putting different pieces in, then you can actually have a pretty big effect. I mean, one piece might only reduce high blood pressure a little bit, or might bring cholesterol down, or, LDL cholesterol, whatever we're looking at with the particles, improve just a little bit. But when you start to implement more of these things, that's when you really, you step back and you see that it can really have a pretty big impact.
Yeah, and well, this is actually a perfect segue to the other question that was asked, and I think is a constant question mark, open for interpretation. We're always waiting for the next research study because, quite honestly, we just want to know, we want it to validate what we want it to say that we want to be doing, and that is related to alcohol. And the reason I'm connecting the two was I was actually just doing an interview. We're developing an oncology assessment with an incredible integrative practitioner. And she was talking, we've got to talk about alcohol because there are some cancers that show, alcohol is a risk factor, et cetera. And so as we were going through that part, she said, but, did you see the research and have you been sharing the information about fiber intake and alcohol intake? And I was like, stop, please share the research with me, So one of the things that I think is really important when we ask the question, and the question was presented, do you think for heart health people have to avoid alcohol, but what about wine and how it's included in the Mediterranean diet and this whole piece? So we'll ask that question, but I will just share that I will post it in the group tomorrow. There is at least one great study that I think validates a lot of the benefit of the Mediterranean diet, which is when you're getting in fiber and also consuming alcohol like wine, the fiber is providing a protective effect against that wine on that front. But Cindy, any thoughts on alcohol and as it relates to heart health that kind of go beyond that, or any interesting research that you want to share?
I think that, again, it's not looking through just a narrow lens with it, but I think there's some of the older research show that it might increase HDLs, right, for some people and provide a little bit of protection. I think the guidelines still, the traditional guidelines with alcohol is no more than 2 a week, right, for a man and 1 a week for a woman. The thing with alcohol, though, is that it does, and it depends on the quality of the alcohol, of the wine. You're better off taking a resveratrol supplement, I think, if you're targeting resveratrol with the wine to get the amount that you need. But what I'm a little more concerned about with alcohol is the estrogen effect potentially it can have, that it does have, women with breast cancer and estrogen positive breast cancer, there is a bit of a risk there with increasing alcohol. And then, of course, the effect it has on your stomach. Mm-hmm. So alcohol, unfortunately, is not a friend of the gut mucosa wall. Mm-hmm. So I would just say, and everybody's different with their tolerance to it, just in moderation. And potentially, then I wouldn't use it as the treatment goal for heart disease, right?
Right.
But, it can be used like in the context of, like you said, a Mediterranean diet, that it's all the other effects there probably allowing it to have a positive effect. There's so many pathways going on with the Mediterranean diet that it's fascinating.
And, I'll share also, because she shares it publicly, but Sarah Gottfried, a physician, has presented her own her N of 1 story. She lives in the Bay Area, and she was drinking wine, and she recently went through some health issues. I believe it was a couple of years ago at this point. But through that process, one of the things that she was looking at was her glyphosate levels, her glyphosate residues. And she actually identified that her wine consumption was where she was taking in the glyphosate. She's like, I've been eating organic, I've been growing or food off, all of this stuff. And then I realized, oh my gosh, my wine. And so your point about the quality of the alcohol and kind of how that's all going to play, and what we know about glyphosate as it relates to gut, and what we don't know about glyphosate because we don't have the research on, I think really just emphasizes and underscores what you were talking about, which is we really can't just look at something for just the phytonutrient, like, oh, I bet it's the resveratrol, that kind of thing. So
right.
It makes a ton of sense. All right, everyone. Oh, go ahead. Yeah.
No, it just goes back to like those 4 key ingredients that I always describe about the GI tract. So anything basically we put inside our gut is going to get to our vessels and have an effect potentially depending on the quality of it, which is why the GI tract is the entryway, right, to the rest of our body and our immune system. So
awesome. Well, Cindy, so if you're a dietitian and you are wanting to, I know I'm signing up. This is going to be an incredible webinar through DIFM on the 13th of February. And you can also connect with Cindy and get her newsletter, which I was talking about. Cindy, what's the best way for people to sign up for your newsletter?
They can. So I have a Facebook group as well. You can join my Facebook group. It's a IFN, Institute for Functional Nutrition Systems Biology, or you can just email me at cindy@ifn.health. So that's cindy@ifn.health, and we welcome everyone to come in and join the group and continue to learn about how the body, systems biology. And it's, I think, a approach for me that has really helped organize a lot of information in the body to make it make more sense. Because functional nutrition and nutrition covers a lot of ground. And we don't want to really miss parts of the body, right? So this kind of compartmentalizes it a little bit and makes it. And thank you so much for having me.
Yeah, and we will for certain have you back here. If anyone can't get to Cindy or they have a burning question, you're watching this after the fact, drop it here in the group, and I'll make sure that she gets that question. We had some different questions come in about the Be Heart Healthy program, and I actually have answered them all in a blog on our site. But yes, if you are a practitioner, this program is for practitioners to invite in prospects to be able to coach them through. I am not taking your clients. I want you to coach them, but we are going to use the heart health assessment and then go through really myth debunking and help look at their total nutrition to figure out things like, are you getting in nutrients from plants? Are you what types of fats, like could we improve the fat blend that you're getting in? Can we upgrade deliciously? So how do we make this delicious with great recipes? Do we go plant-based? Do we go plant monogamous? What's the heart health difference? Some of these things that we will be talking about. And I've invited Cindy to pop back into that. So for those of you that join us there, we'll get a little bit more time with her on just a little bit about how the heart actually works and why it's so important that we keep it healthy. So Cindy, thank you again. Thanks everyone for joining us today. And I will see you back here next week. We're kind of doing double duty in February with heart health and also talking about marketing. So next week we'll have more of a bent on a marketing discussion. All right, everybody, take care.
Thank you, Ashley.